Welcome back to the Health Longevity Secret Show, and I'm your host, Dr. Robert Lufkin. Stem cells and regenerative medicine continue to dominate medical news. Let's take a look at how they work and how they can specifically affect things like inflammation, apoptosis, epigenetics, and mitochondrial health from an expert in the field. Joy Kong, MD, is the founder and medical director of Thea Center for Regenerative Medicine. She is also the founder of Chara Biologics, a company that provides regenerative medicine products to physicians across the United States. Dr. Kong graduated from the UCLA School of Medicine and completed a residency in psychiatry. She is a member of the American Academy of Anti-Aging Medicine. She's certified in advanced cellular therapeutic protocols. She's board certified by the American Board of Psychiatry and Neurology and the American Board of Addiction Medicine. She is also the president of the American Academy of Integrative Cell Therapy and is an avid educator, helping physicians to become fully trained in the science and practice of regenerative medicine. And now, please enjoy this interview with Dr. Joy Kong. Hey, Joy, welcome to the show.
Hi, Rob. Yeah, great to be here.
All right, so great to have you today. I think we share a vision of improving health and longevity through all kinds of interventions that we can make in our lives. But maybe before we dive into some of the exciting details of stem cells and regenerative medicine that we're going to talk about today, maybe we could just take a moment and share how you came to be here and interested in this fascinating area. I have to say, I enjoyed your book, The Tiger of Beijing.
You read it?
The inspirational memoir of a fierce regenerative medicine physician. We'll put the links down in the show notes there.
Oh, that's fabulous.
What a Tai Tai Shanghai Ren. My wife is from Shanghai, and she came over about the same time that you came over. So a lot of the cultural touchstones in your book resonated with me, but it's a great book for anyone, and I highly recommend it.
It's definitely a very candid book, that's for sure. I hold nothing back. My thing of my philosophy of living in the world is always just tell the truth, because truth is powerful. Who am I hiding from? I just give people the whole truth. And, if I'm hiding from the truth, I'm just hiding from, the universe itself. It makes no sense to me.
So tell us a little bit about your background and stem cells, and, how did you get interested in this area from psychiatry to everything?
I know. I think it really, I had to tell a little bit about my whole story, because I did grow up in China. I spent my first 20 years in Beijing. So that, on the university campus, which is probably the top, it's the top science and technology university in China, Tsinghua University. And so my dad was a professor, and I was, my mom's chemistry teacher. So science was something that's always fascinating to me. And I love, the idea of evolution, all the science subjects. Science fiction was my favorite genre. But in the meantime, the culture is kind of immersed in this old tradition, right? Thousands of years of Chinese medicine. So if you go to any Chinese hospital, there's all these departments just like what we have, but then there's Chinese medicine department. So you can go consult with the Chinese. So it's in the hospital, any hospital, there's a Chinese department, Chinese medicine departments. So in a pharmacy, there will be Western medicine, and then there will be all these Chinese medicines. So depending on what your doctor's prescribing to you. So there's really no prejudice. And the lack of prejudice shows up in the medicine cupboard, at home. It's like in the drawers, there are all these medicine, they're all intermingled. Eastern medicine, Western medicine, it doesn't matter. There's no prejudice. And my mom would just, find out what's going on with me. And then she would just go grab whichever one that works best for that situation. So that was, and then I also saw in my mom how she was diagnosed with the cancer, multiple myeloma is probably, it's a really devastating condition. And most people don't live very long, for a few years, and they die. And my mom was 43-year-old at the time. And she actually went to the best tumor hospital in Beijing, stayed there for 6 months, did 6 rounds of chemotherapy, almost losing all her hair and, with blackened veins. And finally she said, let me out of here, because everybody that's in the ward, there are like 10 people in the same big ward, everybody had died. And she said, I'm done. I'm done with living in the hospital for 6 months. So she went back home. She went to a Chinese medicine doctor, and she got this prescription of all these herbs. And my dad was brewing these herbs morning and night, and my mom was drinking these nasty tasting potions. And then she was doing aerobics. That's all she did. Within 6 months, all her levels of blood tests, everything went back to normal. She went back to work full time, and she lived another 32 beautiful years. So that was the story, right? So actually the doctor that was the head of that treatment team was so impressed with my mom's recovery. He came to our house and got the formula that my mom was given and incorporated that into the ward. So he was giving all the patients the Chinese medicine so that people can, it boosts their immune system so they can fight the cancer better. So that is an example of East-West integration, right? So that was kind of where it came from. And of course, I love science. I'm just fascinated by the methodology and how we can, find out, the truth and the cause and effect. And so I went to UCLA for medical school, and, I was actually working with the UCLA Center for East-West Medicine. I was always thinking, I think the most ideal way will be to look at the body holistically, but also understanding the direct links, using scientific language. So that was always in my head. And then because I love the brain and I just think it's so fascinating, that's what makes who we are. And we still don't understand, a whole lot about it. So I went into psychiatry, and even in psychiatry, I was trying to integrate the East and West. And I found it very difficult because the Eastern medicine has a whole different language, right? We talk about the different constitutions, the heat, the dampness, too much, fire, and all these language is completely, it's like a water and oil between East and West medicine. We speak different languages. So I couldn't quite, in my head, really logically integrate the two until I found out this whole discipline called anti-aging medicine, which is really an offshoot of functional medicine, right? And it's really just, I think it carries a lot of old tradition probably about respecting the body as a whole. And in this discipline, in this functional medicine, anti-aging medicine, is that they are looking at the body as a very, very complex entity with all this like web of connections. But then if you want to figure out why this herb works, then you understand all the components of the herbs and you try to analyze what each component is doing. I mean, it's a little bit exhausting because there's, you're trying to study the web instead of a linear relationship, but it does give language to this holistic approach. So all of a sudden I could look at an herb, something that's very holistic, and figuring out how scientifically I could explain in my head to myself and to our patients. So to me, there's this chance of true integration. So that's when I said that this is it, this is my field. And then of course, stem cell therapy is part of the whole holistic approach. I can't think of anything that's more holistic than stem cells, because that's a cell, that's what made us, right? So it contains all the intelligence, and it can talk to the body in a way that we don't have any molecules. We don't have anything that can talk to the body the way that, the complex messages the cell can give. So that's probably one of the most holistic approach, besides light and, some other, energy forms. So that's when I became really passionate about understanding it. But it was one thing to sound great on paper, right? Scientifically, yeah, stem cells, just like the example of embryonic stem cells. It sounds so great. People got so excited. Yeah, now we can, put the cells in the body and they can become all kinds of, cells specific to tissue, and we fix anything, and then realize, oh, whoops, it doesn't work quite that way. And these cells can turn wild and form tumors. So we still haven't translated that into, a good clinical practice. But within the stem cell field, there's certain, more defined, kind of later stage stem cells, not embryonic stem cells. There are a lot of research going on. And what I found is that there's a ton of evidence that they actually work for a ton of conditions. So I started learning them. I started compiling all these articles because I just needed to satisfy my own brain, first of all, that like I got into this puzzle, right? It's like going down a rabbit hole, that the passion of understanding, how life works. And from trying to figure it out in my own head, that's when I compiled hundreds of articles and, categorized by different organ systems and disease categories. And that's actually how I, formulated the stem cell practice course that I'm teaching doctors now, is really because I was trying to figure it out myself, because there's no class, there's not even a good textbook on stem cells. So I had to just find my own way by learning from all these published scientific articles. So that's kind of my journey. I still think, all the integrative approach is very important, but stem cell therapy holds a very special place. And we can talk a little bit more, a little bit later about why it's so special.
Yeah, no, I'm excited about getting into that. And I just wanted to echo one thing you mentioned about sort of east-west approaches to health and disease. And I don't have the cultural background that you had, so I wasn't exposed to Eastern approaches growing up. And I always remember in medical school, first as a student and then as a professor, I tried to be respectful of, ancient Chinese traditions or ancient Indian Ayurvedic traditions, but in the back of my mind, I realized, or I thought at the time, I judged it as, well, what are they talking about? The bowels and the gut and and the chi and all this stuff. And it, I sort of disregarded it as kind of a primitive approach to understanding something that now we in allopathic medicine have all the answers. But since then, allopathic medicine is failing with, diabetes, chronic disease, all these things are just out of control. And at least for me, I've come to the realization that a lot of the information in these ancient traditions, especially about the complexity of the diseases we're facing, the integrative approach, it's not one cause, but it's like you say, a web, a network of things, that there's actually a lot of wisdom in these things that are now even scientifically being proven to be true. Things like the liver and how important it is for, all of our health and metabolism and metabolic disease, and the gut, who would have thought? But, it's actually, the brain, gut microbiome axis and everything. So anyway.
Yeah, exactly. I totally agree with you on that. And I think what's exciting about Western science is that they're nailing it down to the molecular and cellular level. So they're making the connections at a very kind of fundamental level. They're figuring out the receptors, what exactly is the hormones that's affecting it. But then they're not recognizing that you have emerging properties, right? As the system gets more complex, as you have more and more organ systems that interact with each other, so that you have a higher level of relationships. And that's what Eastern medicine is so good at, is pattern recognition. So they're emerging onto the higher level relationships, and they're looking at how everything is interacting together. And that's where Western medicine needs to catch up on. And they can learn, they can at least, have a mentor, which is Eastern medicine. You can always learn from Eastern medicine, and have a mentor and you break through, right? You become even better than your mentor. So, but I think that's, first of all, you need to learn from the wisdom.
Yeah. It's almost like our notions of causality need to be opened up. Like you say, it's not a single factor, but it's many different factors that all contribute to causality, and hoping for, a single drug necessarily that will, block a certain receptor may not be as powerful as some other, like, lifestyle things we can do, or a combination of everything really was what we need to do. But yeah, so stem cells. Now, you mentioned embryonic stem cells. Now, for our audience, maybe you could just let's start at a 50,000 foot level, and embryonic stem cells versus adult stem cells, or what are the types we should be familiar with?
Yeah, so I always go back to the very beginning, which is what we were on day one when your mom and dad, had that spark, and then you form the fertilized egg, finally one lucky sperm, right? Got the egg. And then you got that first, you first origin. And that is the first stem cell. And from that comes this, right? It's nothing short of a miracle. So that original stem cell has potential to form anything, including, the future sperm and egg, and including the placenta, including the baby itself. So that has ability to form everything that's surrounding this new life. And so it will start to divide and form a little ball. And what happens is that there's a little ball, and within the ball, there will be the ball itself, will form the placenta, the tissue that's outside of the embryo, but within the ball is what's called inner cell mass, and that will become the body of the baby. So between day 5 to 7 after fertilization, that's when the scientists can go into the inner cell mass and take out a cell, and they can use that cell. That cell has the potential to become any cell of any tissue in the body. So that's why it's so powerful. And they thought, hey, we got the very early cells, and then this can become anything. Unfortunately, right now, we don't know how to harness this incredible potential, because people hear stories about these tumor formation. They may go to like a clinic in Ukraine, in these places where they actually do embryonic stem cells, and they may inject stem cells. You're always playing Russian roulette, because you don't know when you're going to get a big tumor, because tumor, the teratoma, unorganized, a mess of cells from all kinds of tissue in the body. So we don't know how to control it very well yet. But as the cells keep dividing, that ball, they keep going, and they're still all stem cells. And until they actually form organs, right? When the baby's formed, with specific organs, then you have the cells that are final. They're the final stage, which is a functional working cell in that organ. But within each organ, at the very last stage, they have organ-specific stem cells. So let's say liver, right? There will be these liver stem cells that can divide to form liver cells. So they're always there in the organ, even in the brain, you have those cells. So all over your body, you have this cell, these final stage of stem cells that are ready to kind of form the last, go the last step. But what we found also there's really interesting, some people are doing these cells treatment. So these are very small embryonic-like stem cells. They're pluripotent, which means that they can form into any tissue in the body, any cells in the body. So they have this great potential, and they talk with the local tissue-specific stem cells. So you still have all these hierarchies of different kinds of stem cells, right? And on top of that, you've got mesenchymal stem cells, which are all over your body. Anywhere you have blood vessels, you have these mesenchymal stem cells. So these are, some scientists want it to be renamed medicinal signaling cells, because that's really a lot of what they do, which is to send out signals to the rest of the body, your immune system, and to your local stem cells, and to really coordinate this action of repair and regeneration. And what's interesting was that the V cells won't work very well, the V cells and local stem cells. A lot of times you have a tissue damage, you have damage in a particular, organ. Like, let's just say, you cut your muscle. And if you keep having inflammation, the environment is not correct, then the tissue is not fully healed, and you've got chronic inflammation going on. Do you have stem cells there? Yes, you do. But do those stem cells work well? Are they receiving the right message and are able to mount, their work? No, they can't, because they don't have environment. And that's where the mesenchymal stem cells come in, and they can change the environment of the body, give everybody the right message, tell the immune system, hey, we've got an injury over here. Let's remove some of the debris. Let's calm the inflammation. Let's stop this raging, this war, and let's calm it down so we can start to build, rebuild the nation, right? So then it talks to local, workers and the local either the V cells or the tissue specific cells, so everybody can work together and actually rebuild. So you got this complex system that involves stem cells, but it involves different kinds of stem cells. So what's funny was that we didn't know that we had stem cells until we had the stem cell science is still fairly new, realizing what stem cells were, which definition is that they have the capability to self-renew, and they're able to replenish the tissue that they reside in. So that's kind of the definition, that the capability to self-renew. And it's the first time we used stem cell therapy was really the bone marrow transplant. And we had no idea that we're doing stem cell therapy, that was back in the 60s. No one knew this was stem cell therapy. They just thought, we're giving them, the bone marrow. So they didn't know why it's working. So that was the first stem cell therapy. But then for years, they thought those are the only stem cells left in the human body. They thought they're all in the bone marrow, which is completely untrue, because now we know that there are stem cells everywhere. So that's kind of exciting evolution of the field.
Is it fair to say with stem cells that that the difference between a stem cell and an adult sort of mature cell is all in the epigenetic programming? Is that a correct way to look at it? And we've had a couple other speakers talk about epigenetics as far as DNA methylation for biological clocks and epigenetic clocks. So we've heard a little bit about it, and some people have touched on the Nobel Prize winning Yamanaka factors and all. But those are for basically rewinding the epigenetic markers on adult cells to rewind them back to some sort of some earlier stem cell form. Is that right?
Exactly. And then what's incredible is, what is the guiding intelligence behind this? That's what's fascinating, right? From the very first cell, how did that first cell know that we're going to divide into 2 and then 4, and then we're going to form a ball, and then from that ball we're going to start to form more complex structures? How do they know? So yes, there are things turn on and off, all the way down to where we are right now, where there's, it's like the final stage where we still have on and off, but we've lost, some of the capabilities. So we can now live and enjoy life. And then later on, we're all going to perish. But that's just a natural, like, what is the intelligence that's guiding this? That's a whole other question, which is very exciting. Of course, as a psychiatrist, that's really, cool to ponder.
Yeah. I mean, so many possibilities there. Well, so to summarize up to this point, then we have embryonic stem cells, which come from embryos. They're pluripotential, but the problem is this teratoma formation and kind of wild cell growth. Is there malignant potential too for there? Is it mainly benign teratomas as far as tumor growth? Is that the main risk factor?
That has been what's been the most reported. So that's mainly what all these scientific articles were talking about. But definitely when we obtain stem cells from the adult body, what's interesting is that they can promote tumor growth. And that's one thing, that's one reason I set out to study different types of stem cells, to find the safest one for patients. Because once we realized that there are, bone marrow has all these stem cells, and people found out, fat has a lot of stem cells. So a lot of the stem cells they got, of course, there are different types of stem cells, but a lot of what they got was really the stem cells that are wrapping around the blood vessels. That's nourishing the fat. So they're getting a lot of those stem cells, the mesenchymal stem cells. There are other stem cell type too. So they will isolate those, and they realize, we can inject people with this either locally or systemically, and they're getting good results. The problem is there are also reports of promotion of tumor formation. Like if someone is prone to cancer or already have a little speck of, cancer cells, which probably most of us have. It's just a matter of how vigilant our immune system and how strong they are at getting rid of them. So we probably all potentially, cells can go haywire and they can start forming a little cluster. And if your immune system is good, you get rid of it. But if you got all these new signals of these stem cells who, that's the difference between an older stem cell, older MSC, right, along the blood vessels that you get from a fully grown human, let's say, someone is 40 years old, comparing to a mesenchymal stem cells from the umbilical cord. These two are two entities. They're drastically different because if you look at research, an adult MSC has the potential to promote tumor growth because they have lost what I believe they have lost some of the intelligence that's embedded in the younger stem cells, because the younger MSCs, when they encounter an abnormal cancerous or precancerous cells, they can tell the surface receptor there's something wrong with the cells. So they will send appropriate signals. One of the signals is called trail ligand. It actually triggers this apoptosis, programmed cell death of these cancer cells. So they can kill the cancer cells. But if you have these MSCs, they were, it's almost like, I call it cellular senescence or cellular dementia. They forgot that these are your enemies. These are not things that you want to, nurture and grow, but they don't recognize that. So they were like, oh, our job is to secrete growth factors. We want to help everything to grow. And that's where the problem comes. That's why I'm so passionate about using appropriate stem cell types so that you minimize any potential harmful effects. Because as we get older, unfortunately, even our stem cells get older and get more sluggish and lose some marbles.
Okay, so to recap so far, then we'll take embryonic stem cells and we'll set those aside because of risks for teratomas, and they're not available in the United States. They're not used without some sort of study because of the risks associated with them. And outside the U.S., who knows? It could be the Wild West, but at least in the U.S., we don't use those. So we'll set the embryonic stem cells aside because of those issues with them. And now we're talking about mesenchymal stem cells, which can either be from an adult, if I understand you correctly, or from the umbilical cord, right? Or from umbilical tissue. And
tissue.
And for those, there are some disadvantages with the adult forms because of they're further down the differentiation, like you say, and certain factors can be problematic. So ideally, what we want is not embryonic stem cells, not adult mesenchymal stem cells, but ideally umbilical cord stem cells for a number of reasons, or umbilical tissue stem cells, correct?
Yeah, I think the stem cell field is still evolving. Possibly we can find, better tools, but I think right now the best tool is the stem cell. So mesenchymal stem cells is one major type. There's still other kinds of stem cells, like endothelial progenitor cells and hematopoietic stem progenitor cells. All these are important. They all work together. That's why when I use the product, I include different stem cell types because I know they work synergistically together. I don't want to fall back into the trap of this very simplistic thinking that, one cell type is going to solve all the problems. If you talk with stem cell scientists all around the world, they will tell you there's no one cell type that's good for every disease, every condition. Life is not that simple because all these cells, they work together. So I want to bring all the different cell types, knowing that they work together in nature. So I'm going to give it into the human body so they will work it out. They will work together. So yes, when you get cells from the birth tissue, which includes the umbilical cord and placenta, these cells, it's really fascinating because they're kind of in between embryonic stem cells and the stem cells even in the baby, because the baby's stem cells are still considered adult stem cells because they are a fully formed human, and in the embryological terms, and they're an adult, so their stem cells an adult stem cell. But when you look at the birth tissue, because they were sequestered, they were kind of caught up in the formation so early in the embryogenesis when the baby was formed. So they still kept some of the characteristics of the embryonic stem cells. You can look at that. You can detect that through looking at surface receptors. So a lot of the surface receptors that were present in embryonic stem cells are still present in the birth tissue derived stem cells. But lost in the baby stem cells. So they're kind of in between, but they don't have teratoma risks. So they can't form this uncontrolled ball of tumor. So they kind of have the best of both worlds right now. And because they're so early on, and also because, at least from what a lot of people use and what I use is that there's a lot of, unless you're using umbilical cord blood cells, but if you use umbilical cord tissue cells, there are a lot of mesenchymal stem cells. They have the ability to modulate the immune system. So even if you give a transplant, tissue transplant of these cells to a person that's completely unmatched, that you haven't tested or blood types or any other markers, you completely unmatched, it's extremely safe. It's almost, there's extremely, extremely low chance of some kind of reaction. Does it happen? Yes, it can, but very rare. But good luck with trying to do a bone marrow transplant without matching, right? Because even if it is perfectly matched bone marrow transplant, there's still a rejection rate. So that shows you how complex the human body is, because just because we understand some of the major surface markers doesn't mean we understand all the potential surface markers, right? So we're testing for some of the major ones. We think, okay, we're matching these ones, and then they're going to be a match. They're not going to reject. No, there's still a rejection rate. But if you put a younger cell, even though it probably has all kinds of surface markers, when the cell matures, it can form all these different surface markers. But because they were so young, they may not form it, because they work with the host, they work with the new body. This is why research have shown over 60% of women actually have Y chromosomes in their body. And this is fascinating, right? There's no chance of it unless we got it from a male. And we can get it from either carrying a male baby or having a male sibling who may have died that we didn't know about, right? So that in utero, that there's some kind of genetic, the cell exchange, or from male-female intercourse. So that there is a potential of transferring of this genetic material. So that's actually part of human nature. And if you look at how many women actually walk around with Y chromosomes, then this, early, kind of, settling down of cells from another human being is actually a commonplace occurrence. So that's pretty exciting. Give you kind of a new perspective on, it helps you to understand, a lot of people are scared. Oh, I don't want to have other people's DNA in my body. But you know what? It's actually part of the human condition. It's just part of the way humans have always been. You carry around some other people's DNA in you.
Wow, yeah, we have so much to learn in that, and even the fascinating work on exchanging DNA between species, as as bacteria get together and they trade resistance across species and everything. And I'm sure it happens, like you say, with higher animals all the way up to us. But
yes.
Well, before we leave the high level view of stem cells, one quick question. Another we hear a lot in the news, just kind of definitions. We hear a lot about exosomes. Maybe you could just take a moment, and what's the difference between a stem cell and the exosomes, and what are the values of each of those and trade-offs of using those?
Okay. Yeah, stem cells communicate with the world, with the human body in a variety of ways. And exosomes is one major way, not the full way, because stem cells can secrete growth factors that they don't put into the exosomes. But a lot of their messages are included in this tiny little package. They're kind of nanoparticles, very, very tiny. So they will put their messages into this package, and then they will bud it off and then send into these little nanoparticles that will circulate in the body and get to and start to interact with your body and produce certain effects. But one thing to realize is that these are secretion particles. So they don't contain DNA. They do have microRNA that can interact with the DNA, but they don't have DNA to respond to the environment. So the cell contains DNA, and the cells is like the mothership is producing these little particles, sending out these messages. So what some people have done, partially from making things maybe simpler, or to avoid the having to deal with the FDA's restrictions on cellular therapy, they decided to just collect these particles, and then they will grow. They can either concentrate it by centrifuge from maybe amniotic fluid, or they can get some mesenchymal stem cells and grow them in culture. And these cells will just keep spewing out these particles. So it's somewhat of a blind environment, right? So you can nurture them, help them grow, but it's a blind secretion of these molecules that's supposed to work with your body. So do they contain a lot of growth factors? Yes, they do. Do they produce beneficial effect? Yes, they do. But limitation is they're short lasting. So they get broken down very quickly in the body, within days, they're very highly degradable, but they do send out all these growth factors and microRNA that can produce some downstream effects, which is wonderful because microRNA can actually interact with the DNA and help change methylation patterns and actually help repair the DNA. So in general, the effect lasts for about maybe 2 to 3 months. Then people have to do it again because you just got one wave of signals. It can promote some kind of repair, but then you run out of your tools, right? So then you need another treatment. Where stem cells, what you can imagine is almost like putting into your body a pharmacy. So and the pharmacy is smart because whatever your body needs. So this is not growing in a culture, in a big vat. This is in the human body and actually sensing what your body's condition is. What's the inflammation level, where the inflammation is. So first of all, it can get to the areas of inflammation. The cells will be attracted to that area and work on that specific location. And then depending on what that location needs, the cells will secrete relevant exosomes. It may not put, the same package of information into, when you have the cells, knowing the local environment, they will secrete a different set of signals. And it's a lot more targeted response, a lot targeted kind of therapy. And the cells generally live in the body for about 3 months. So they don't live forever. Yes, some do stay. That's why, we have the chimerism, so that we have other people's DNA in our body, but generally probably only 1 to 2%, the most 5% of the cells actually stay, but in most of them will die. Like any cells that you've activated, there's a finite lifespan. So in general, they live for about 3 months, but during those 3 months, they will produce countless exosomes, right? Not only they can expand in number, they can grow, but they can keep producing these exosomes, which in a very targeted manner. So that's why I always prefer stem cells. And another problem with exosomes is that exosomes doesn't have intelligence of responding to the environment on its own. It's already a set number of messages. The stem cells, when it gets to environment, can sense, oh, this is not a time for me to secrete growth factors. I need to secrete something else to tell the cells to die, right? If the cells are abnormal, dysfunctional, senescent, or cancerous, then I secrete different signals to tell the cells to die. But the exosomes tells everybody to grow because that's, they were grown blindly in a vat. And then they just tell, so if you do have an existing tumor or some kind of precancerous changes, there is a potential for this to enhance the growth. So that there's a risk factor. So I almost never give people exosomes alone because of that concern. I want to have the intelligence of the cells to back it up. Yeah.
Okay. Yeah. So the ideally the mesenchymal stem cells will produce their own exosomes once they're in your body, and that's the natural thing they do. And by just giving exosomes, you remove the intelligence of the cell and the ability to respond and everything. So I see that as a trade-off there that we might not want to make. But so you're the founder and medical director of the Thea Center for Regenerative Medicine, and so you actually treat patients with this type of technology, these type of cells. I'm wondering for what sort of patients, how as a patient, how are there certain conditions that would benefit from stem cells? Or are there certain lab tests that people should take? Obviously, for longevity, that's something we'd all like, but
Yeah.
what do you look at in patients? I guess first, what diseases, I guess, that would benefit from stem cells?
Right. Of course, I can't make that statement
Oh, okay.
because I can't make any claims. But
Right.
Yeah. I encounter that every day, of course, in the clinic.
Sure.
People call me saying, "Doctor, I have this and this. Can stem cells help me?" So the way I answer it, because the only FDA indication is blood disorders, when you can give stem cells to reconstitute the blood, and that is the only FDA indication. So when everything that's outside of that, what I look at is research studies. Has there been evidence showing benefit? So I will analyze with patients. I would say, here, yes, okay, you have COPD, or you have end-stage renal disease, or you have psoriasis. Okay, let's look at what research have shown. So this is where, my whole library of studies, why it's so helpful and so powerful, because whatever questions they have, if somebody somewhere in the world has studied it and published it, then I can utilize that data. I can tell the person, yes, there has been some benefits, and we can, I think there may be a good chance that this will help you. But there are a lot of people who suffer from more obscure conditions that no one has studied. And then what I do is that I analyze the pathophysiology of the condition. So how did you even get the condition in the first place? Is there some kind of immune dysregulation? Is there inflammation that's part of the picture? And even genetic problems. I can't fix genetic problems per se, the gene level, but a lot of genetic diseases is not really the problem with the gene that's causing the disease. It's the downstream effects, right? That's causing tissue damage, and that's how you manifest with the disease. So if the tissue damage is in place, and there probably are inflammation that's part of the picture, and immune dysregulation, then at that level, I can bring the stem cells in and help them. So in that sense, it's a broad range of application. I can assist the body to fix the inflammatory condition and to modulate the immune system to make it more reparative and regenerative in nature. So I have in my clinic seen great results in all kinds of conditions. So I mentioned COPD. It's pretty incredible. I mean, that's the first place the cells go when you put into intravenously. It goes to the heart and pump into the lungs. You have a lot of inflammation, a lot of problem in the lungs, because the mesenchymal stem cells has these anti-fibrotic properties, so it can break down scar tissue, and that is, powerful, right? The only thing we have these days are steroids, and it's so regenerative, and the side effects. I was telling patients, I was like, if stem cell therapy has even 1% of this kind of side effects that you see on the list of any medications, it's going to be shut down. The side effect profile has been incredible, because we're dealing with life here. It's human is life compatible. So COPD has been great. I've reversed somebody's liver cirrhosis and stage. That was somebody that was in hospice, was on the brink of death. And people with diabetes, with high blood pressure, and with severe autoimmune diseases like rheumatoid arthritis, lupus, severe psoriasis, people who have, all kinds of orthopedic issues, any kind of, joint, tendon, injuries and impairments, and then a lot of neurological conditions. The neurological conditions would take longer and is a little bit more unpredictable, but I've definitely seen good results for people with dementia, with stroke, with ALS, and with post-traumatic, the TBI, traumatic brain injury, and also Parkinson's and MS. So I've definitely seen people benefiting from these. And I also do treat a lot of kids who have autism, because we had such great success with autistic kids. So the autistic community is very, they're very tight knit, and they talk to each other. So I have a lot of autistic kids who come to my clinic, and I've also have Lyme disease patients, because we had great results treating Lyme disease, and you know how devastating it is. And Lyme disease is a complex. So you need to, on one hand, kill the organism, and then you need to boost your own immune system so you can actually maintain that, healthy state. So stem cells, we have seen people who had brain lesions from Lyme disease, to the point where within a couple of months, the brain lesions were gone. That was shown on MRI, which was pretty incredible. And that's correlated with incredible clinical improvement. So wow. Yeah, so a very broad range of conditions.
Yeah, the ability to influence inflammation, like you say, and fibrosis, which is at the root of so many chronic diseases, all the ones you've mentioned and more. Yeah. That is such a powerful tool.
Right, all the fibrosis. So yeah. Which reminded me of the erectile dysfunction.
Yeah.
Male, the penile, and then Peyronie's, which is inflammatory plaque formation. That's very easily reversed. So people have curvature of this penis. All of a sudden, after one treatment, it's all straightened up, right? So it's really great to see the power the cells have.
Well, what about, like you say, inflammation, fibrosis? Those are all the chronic disease findings for longevity. So if a patient comes in for longevity, what sort of biomarkers do you follow? Are there any things you can use to see the results with with a longevity patient or with anti-aging?
So yeah, actually half of my patient population are longevity patients. So these people have already taken great responsibility for their health, eating healthy, exercise, and they're high functioning. They just want to stay on top of things. They don't want to decline, right? We all have finite lifespan, but what we want is like the candle. When you think of how we want to live, it's like you have a long candle, it burns bright and bright and bright until the very last breath, and then poof, it's gone. And that's how, ideally how we live our life, right? Like that candle. So that's what patients came to me for. And so the markers that you can follow, I mean, there's a lot of debate on what really are the best markers, but what I found are helpful are the, CRP is helpful. So high sensitivity CRP, and then the lipid panel actually tends to show a lot of improvement in their, cholesterol, in their, the cholesterol markers and the lipid markers, and people's blood sugar, that can help improve the A1C levels. So other ones are a little bit, that's a little bit more individualized. I also look at hormone levels and some other, a few other markers, but mostly I would look at those, and blood pressure. That's one indication as well, showing improvements. There are people who have had essential hypertension, and within a couple of weeks of stem cell treatment, the blood pressure point will drop 10 to 15%. So that's pretty cool. Yeah.
Wow. So I assume by the nature of your practice that patients have to be, that you don't have a telemedicine component to it, that they have to be able to travel to California to work with you. Is that correct?
Yeah. So I do have medical license in Florida and Colorado as well, but right now I'm just focusing on California, but I do plan to set up new clinics in other locations, and also I'm a medical director of a mobile IV company, so we're going to bring this to a lot of places. But right now, yes, people do fly from all over the country and then the world to come see me. And the funny thing is, I chuckle at this because people, the only people who complain that I'm too far are the people who are in Los Angeles, because I'm in a particular location in LA, right? LA is so huge and sprawling. So wherever I am, someone is going to complain that I'm too far, but nobody from other states or other countries ever said you're too far.
That's funny. Well, question, patients come in, is any of this covered by insurance? Obviously it depends on the plan and everything, but in general, should patients be expecting to pay for this out of pocket, or is it kind of a mixture of different things?
Yeah, I would say, unless you have some rare insurance coverage. I've seen people who have, some really high-end insurance plans that are willing to cover. most of them, no, because they don't consider this FDA approved and this is tissue transplantation, and they usually won't go for it. Yeah, we can always attempt, but
and to be clear, the technology that you're using for mesenchymal stem cells, I mean, it is FDA approved, but this is an off-label use for other indications, correct?
Actually, no, this is a good point, because because this is where a lot of people are confused and they're not sure, is this legal? Can we do this? So whether or not it's legal depends on what category the stem cells that you're using falls under. So the FDA decided, when people start doing a lot of stem cells, FDA decided that they're going to have some kind of guidelines. And they decided that if you get the cells from the human body, whether from adult or from a birth tissue, if you start to manipulate it by adding chemicals, using enzymes to digest certain connective tissue, or you start to grow them into large numbers, then you're potentially making a drug, because you're changing the characteristics of these cells. And so if you do that, then you will have to get an IND, investigational new drug application. So you have to study, you have to put all your patients under a clinical study. Otherwise, it's not legal to just give it to people. But if you don't manipulate it in any way, that falls under a whole other category called Section 361. So if you're 361 product, which is what we use in our clinic, because we extract the cells mechanically from the umbilical cord and other tissues that we utilize, and then we don't do anything except that we nurture them and then put them in the right freezing process, and then and then they're in this ultra low temperature. They're kind of frozen in animation until they're thawed out and given to patients. So basically, we didn't manipulate the cells in any way, and that the FDA says it falls under 361, and you can give it to people as tissue transplant. So it's not a drug, just like when you do a liver transplantation, right? The liver is not a drug. So you're a doctor, you are allowed to do liver transplant. And same thing as blood. This is not, no one manufactures blood. We just, as doctors, this is a medical treatment. We can give the blood from one person to another. So same logic.
I see. Oh, that makes sense then. And then for just ballpark figures, how much do people pay for this? And just a general range. We had some people are doing gene therapy with gene transplants, and the procedure was $100,000. And I know drug costs can be all over the place, but just to give people a sense, what is the range for this typically?
Yeah, so it does vary quite a bit in the U.S. also. But a lot of people go overseas, the general figure I hear is about, $25,000 somewhere, like kind of there, that it can go up over 30,000, but that's kind of what you can expect by going overseas. And the US, so in our clinic, I try to be, very reasonable. So our range, it really depends on person's body weight, their age, and their health condition. So those three factors, it determines the dosage, and dosage determines the cost. But in general, in my clinics, between $7,000 and $15,000. So yeah, most people. Yeah.
And you also are an expert in actually making the preparation of the stem cells as well through Chara. So you have expertise in that area as well, as in addition to treating the patients.
I don't claim expertise. I've read a lot of scientific articles. I do work with amazing scientists who know how to work with the cells. What I bring in is kind of this overall greater philosophical understanding of how different cell types in different tissues, how they work and how they may work together. So I designed my product in the sense I picked different tissues and to bring the different compartments, cells from different compartments into one. Because if you look at what people use in the country, they pick one compartment and they stay with that. Let's say either umbilical cord blood or umbilical cord tissue. And they all say that, they have the best product, but I've used all of them. So I know that yes, for some circumstances, this, either cord blood or cord tissue is the best. but not for everybody. So I know there's benefit of each. And because I know how the cells can work with each other, how they actually enhance each other's function, that's why I want to bring them all together. So what I always say is, there's a reason that God created all these stem cells, right? So no humans are capable of making a single cell. We're not capable of doing it. So somebody, some intelligence created these cells. And why do they have all these different stem cells? Right? And who am I to pick, oh, mesenchymal stem cells is great, so that's what I'm going to give you. Who am I to do that? I'm not going to play God. I'm going to give you everything that God has created. And then I'll let them work it out.
I mentioned in the introduction that you're also the founder and president of the American Academy of Integrative Cell Therapy, where you're involved in education and teaching of other physicians as well about who want to learn about stem cell therapy. And is that aimed at patients also for that, or is that mainly more physician level training?
Yeah, it's really for doctors, but can also get a lot of great information on the website. It's aaict.org, because I have some research excerpts. I have some case studies that people can actually look at the different conditions that have, people have seen great response in. But the training course, which is a 6-hour online training course, I used to teach, it's a full day course. I may start again, actually teaching it in person, but it was very, very labor intensive. So I put it online to make it very accessible wherever the doctor is, because we have, international doctors. It's, very difficult. So now they can access it anywhere, and they can rewind, because if they come in person, they can't rewind, right? If you didn't pay attention, the boat has passed. So yeah, that's I want people to really know what they're doing and feel confident. I'll tell you, what's funny was when I was teaching the class in person, I was just focusing on the lectures. So I didn't know what the doctor's response was, but my staff was telling me, they said, the doctors were making these noises. They were like, whoa, wow. And so they were, because light bulbs started to go off, because I started talking about different diseases and different conditions and how research have shown benefits. All of a sudden, they probably are thinking about this patient, that patient. Oh my goodness, I didn't know stem cells may help this too. So I mean, how nice to know that you have this tool, right? You can help people that you haven't succeeded at helping at.
Yeah, it's great that you're giving back not only to the patients, but also to help other physicians to learn about this and disseminate the technology as well. Well, in the last couple of minutes, we always like to ask our experts, like yourself being an expert in this field, about knowing what you know about regenerative medicine and health in general. What choices do you make, if you don't mind sharing, in your own lifestyle, as far as diet, health, anything like that, exercise, or stem cell treatments? I mean, I have to say, you look about 21 years age.
Oh my God, thank you so much. I love talking about my age, because I'm 50, and I do feel 25. So I want to look the same way when I'm 75. And this is the first time in history that is possible. And I want to show everybody it's possible. We're here. We actually have the tools. So I'll be happy to share. So I definitely, I practice what I preach, because I think I just have this respect for this incredible, gift, which is our human body, right? So we're more than our body, but this is the body that we've been given, and I want to respect it. So then I don't poison my body, which is all those processed, food and, things that has a lot of chemicals and additives. So I try to eat very healthy. I eat organic whenever possible. And I try not to eat, a high carb diet. Once in a while, high carb, it's okay. I'm not really dogmatic about it, but I generally try to reduce it. I focus on, a lot of vegetables and fruits and lean protein. So that's kind of the diet. I call it anti-inflammatory diet. That's what I want to focus on. And then exercise. I do exercise every day. I love Pilates. It's actually Legree Fitness. And it has a little bit more cardio component. It's more fast-paced kind of form of, Pilates. But I love doing that. And then, I go to Zumba dance, maybe 2 to 3 times a week, because you get the music, it's good for the soul, you got camaraderie, right? You're dancing around, you're feeling the joy of having this body and being able to move and express yourself. So, and that aside, I think detoxification is very important. So I tell everybody, I want you to eat, everybody who comes to me for stem cell treatment, eat an anti-inflammatory diet, move your body, and then detox. One of the best, I think that the best detox method is infrared sauna or other sauna, but infrared sauna is fantastic. And then you can get rid of a lot of the organic, kind of toxins, and also heavy metal. You get a lot of things sweated out. Your skin is a huge detox organ. So I do that at least 2 to 3 times a week.
2 to 3 times a week. Okay. Like for an hour, is that your dose?
Or for about 40 minutes. Yeah. And then I have an infrared sauna in my clinic. Actually, I want people to, here it is. And then on top of that, I love stem cell treatment. I think it has a lot to do with how youthful I look, because for the last 5 years, I've been doing IV stem cells every 3 months. So like clockwork. Actually, after we finish, I'm doing my next stem cell IV infusion. I'm super excited. What it has done is more than what I anticipated, because I really did it because I saw how many people benefit from it, because they have diseases and I didn't have any problems, but I want to be vital. I want to be, vibrant. So I started doing it really because I read the science. I knew how they work, getting rid of senescent cells and improving the immune system. I wasn't going and saying, hey, I want to look young forever. It wasn't part of my goal. I just wanted to be optimized. And then people were commenting, hey, what have you been doing? You've been looking younger. So I realized what happens is that there are changes both internally and on the skin level that, so skin is not, you can't achieve youthful look just by putting creams and doing these microneedling, that's not enough, because all your muscles underneath your skin, fat and the ligament, everything start to sag and lose their vitality. So if you don't address everything from the inside out, you're going to have super smooth skin, but they're all hanging, right? So that's not what you want. So what I realized is that I was cleaning myself up or rejuvenating myself up from the organ, from the inside level, and my skin is just a manifestation of what's going on inside. So I want people to take a look at their skin and realize that when you think you're getting older, that you are looking at your face and the wrinkles and how, things are not what they were, but think of that in your organs. Your heart is wrinkling up, your liver is wrinkling up, everything is drooping, and your skin is just a manifestation. So I want to give people the tool to rejuvenate from the inside out. And so definitely, you are revitalizing all your tissue and your brain and your muscles, from the inside. That's why I've been giving this lecture about stem cell therapy as an anti-aging tool. People have studied what happens after stem cell infusion, looking at acetylcholine levels in the brain, which is really crucial, and in the muscles, and look at their growth factor levels and inflammation markers. When they did a stem cell transplant, these older animals, all of a sudden, all of these markers went back to the younger level. It's powerful evidence that this is not, not only that they're acting younger, their fur is better, their spine is straighter, so there's both the physical manifestation and the laboratory, confirmation. So that's why I do it consistently every 3 months. And I tell people you should do, if you want to kind of, slow down or, almost stopping the process aging, you might want to do it every 6 months. But if you want to be more aggressive, if you want to reverse it, maybe you want to do it every 3 months, because that's what I've seen. And, it's a fun, like a side fact, little, factoid, that they looked at the brain of women who have given birth to children, to a kid, and they looked their age equivalent of women who have not given birth. The women who have given birth, their brain is 5 months younger. And this is fascinating, right? So on average, their brain just got rejuvenated a little bit. So what I tell people is like every 3 months, I have a little mini pregnancy. And then I just got, my brain has gone back 5 months. So if you keep doing that, right, every 3 months, you go back 5 months, hey, you're going younger and younger.
That's right. That's right.
Yeah. And on top of that, I do check my hormone levels. If there's, because there's the thought, is your hormone level lower because you're getting older, or you're getting older because your hormone levels are lower, because all your cells are not receiving the right signals. So I do check my hormone levels and make sure that, I have the right, mostly, thyroid, estrogen, progesterone, those are the ones I'm focusing on. Mm-hmm. And for male patients, I focus a lot on testosterone. Testosterone is a little touchy for females, but that's kind of what I do in general. Yeah, I don't take a whole lot of supplements, and they get very exhausting.
Mm-hmm. Yeah, it's hard to manage all those. Well, how can people follow you on social media? We'll put everything down in the show notes, but maybe you could just, for people who are listening, you could just tell them your website and the best way to stay in touch with you.
Yeah, so probably the best way, our clinic website, so Thea Center for Regenerative Medicine, is theacrm.com. So THEACRM.com. And, people can reach our clinic by, just go to the website and, send us a note, our email info@theacrm.com. And the social media, I do have a personal account, which is Tiger_Beijing. So it's Tiger of Beijing. That's kind of my personal, is more for personal expression, but there's one that's more professionally oriented, is Stem Cell Dr. Joy, all one word. So that's, that's probably the best way. But AICT.org, that's a good resource for patients because it's an educational website. I was able to discuss case studies. Whereas, you as a physician, you probably know, sometimes, we have strange rules that we can't talk about cases in some circumstances, which is really sad. And I'm really sad about it, actually, because I in a way, I risked my life to come to this country. It's not that bad, but it felt like, I was go all in, whatever it takes to get here, because I could gain certain sense of freedom. I could say what I believe is true, and this country is not going to stop me. But the fact that I can't post patient testimonials, even those from their own words, and that somehow is looked upon by the FDA as making claims, is saddening to me. It's against why I love this country. It's not what I love so much about this country for. I still love America, but I hope it gets better.
Yeah, it's definitely a work in progress, I think. Well, thank you so much, Joy, for taking the time to spend with us today. It was great getting to know you better for the hour, and hearing all about the amazing work you're doing with stem cells.
You're welcome. I really enjoyed speaking with you. Yeah, you're a great host.
This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling. The practice of medicine or the provision of healthcare, diagnosis, or treatment, or the creation of a physician, patient, or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time.